Welcome back. Well, today we have on Dr. Stephen Daines with Harvard Eye Associates. He's been with them for about 6 months. Always good to meet someone new over there at Harvard Eye. Nice to have you here.
Thank you for having me.
Yeah, so explain exactly what your role is over there.
Sure.
And a little bit about your background.
So my name's Dr. Stephen Daines. I'm a facial plastic surgeon at Harvard Eye Associates. And my role there is to kind of spearhead their efforts in developing a practice that offers cosmetic surgery to the people in this neighborhood, and also reconstructive surgery of the face and neck region. And so I'm both a cosmetic surgeon and a reconstructive surgeon, and I focus above the shoulders.
All right. I know over the years that when we've had some of the doctors on from Harvard Eye, one of the things that they've talked about that I've always found kind of interesting and would certainly fit in with what you do over there is quite often people whose eyelids begin to droop as they get older.
Right.
And I'm sure that's something you cover, right?
Absolutely. So as we age, a lot of different things happen. One of them is the tissues start to fall, and that's just from the effects of gravity and weakening of the tissues over time. And one of the areas we see that is in the upper eyelids and also in the forehead. And so sometimes it gets bad enough where we're not actually seeing everything that's out there to be seen because the eyelid skin is hanging over our eyes. And sometimes even insurance will cover that if we meet certain criteria. And so I do a lot of surgery on the upper eyelids and on the brow region to help people see better. And the secondary benefit is they actually look better too.
Yeah, so that would fall under, I guess, reconstructive surgery, right?
Absolutely.
Because there's a real medical need.
There's a medical need for it.
Now, your background as far as your training, is this what you kind of specialized in, or did you have a general sort of cosmetic practice and then decide to go into this?
So this is what I planned on doing from the beginning.
Okay.
And actually it took about 15 years after high school to get to where I am today as far as my education and training. And so after medical school, I did a 5-year residency in head and neck surgery, and then an additional year of fellowship where I focused exclusively on plastic and reconstructive surgery of the face, neck, and nose.
Wow, so head and neck surgery, was that internal or external?
Both, actually.
Okay, so you really, when you're evaluating a patient, you really know what's going on the inside as well, and how what you may be doing is going to maybe affect the facial structure and things like that.
Absolutely. I mean, you know, the old saying goes, beauty is only skin deep.
Yeah.
We realize that it actually goes a lot deeper than that. And so I understand the facial anatomy starting at the facial skeleton, so the bones, and then the soft tissues and the skin. And for both cosmetic and reconstructive purposes, I can manipulate those areas to achieve the result that we're looking for.
Do you have a different way of looking at rejuvenating someone's face and the cosmetic surgery of it?
I do.
That may be different from other plastic surgeons and other ways of thinking.
Yeah, so I believe in two things, a natural approach and also a comprehensive approach. And so if you picture your face like a car, and over the years your car gets in some minor fender benders and gets some dings and scratches, and if you only fix the paint job and don't fix the dings and dents in the car, then you're not really doing that car justice. And so I look at the face the same way. So not only are we improving the paint job, so fine lines and wrinkles and brown spots, but I'm also trying to fix the soft tissues and some of the more underlying factors that are contributing to the appearance of aging.
Yeah, and I can see how your background would really benefit there.
Absolutely.
So you were able to determine if something maybe is going on more internally that's causing something externally, right?
That's right. I you know, my consultations are complimentary, and I spend usually between 30 minutes and an hour with a patient, obtaining their medical history, finding out what's really going on, and helping to help formulate a plan with my patients to achieve their objectives.
Let's talk about some of the procedures that you do. You mentioned the eyelid one, which obviously can be a huge benefit to someone. How long does something like that last? Does someone have to go back for maintenance, so to speak, every few years?
That's a great question. So most of these rejuvenation surgeries that we do should really last a lifetime. So if
Okay.
a patient had a twin and the twin did not have cosmetic surgery, the patient would always look better than their twin. But sometimes after 10 to 15 years, these procedures can require a small touch-up, and I explain that to patients, and they're usually happy to have a result that lasts at least 10 years.
All right, so much like something might be done with your eyes, that you get new contacts, you get new glasses.
Yeah,
every
exactly.
so often you got to go back and reevaluate that.
Yep.
Are there minimally invasive procedures that you can do? Maybe someone goes in just for a few hours, sort of outpatient procedures.
So all of my procedures are done as an outpatient.
Okay.
And there are less invasive options. Some of these include a procedure called a mini facelift. This uses less extensive incisions, can often be done with just sedation instead of general anesthesia,
Okay.
and the recovery is quicker. There's also injectable procedures. We've all heard of Botox, Juvederm, Restylane. These are fillers that can be used.
Right.
And there's also things like chemical peels and lasers that can be done to rejuvenate the skin. All of these are less invasive and have less downtime, and they're very popular.
Okay. When you evaluate a patient, and I imagine sometimes you might get somebody who's asking for more than what is realistic. How do you kind of work with that?
We often think about cosmetic surgery, and we see the examples of patients who have had way too much done.
Yes, we have.
That is by far the exception, not the rule. And I
Okay.
rarely have to tell patients that they're not a good candidate for a given procedure. But I believe in being honest, and I think people truly appreciate that.
Yeah, I can see where they would certainly appreciate that. And the outcome, either way, is going to have them looking better anyway, right?
That's right.
Being that you work over at Harvard Eye, you obviously work hand in hand with the doctors over there, the eye doctors and all. So you have that benefit that if there is cosmetic surgery around the eyes, they're also getting examination to see maybe there's a problem with their eyes in general first, right?
That's right. We believe in a team approach at Harvard Eye Associates, and so we will often schedule consultations where someone will have their eyes looked at to make sure that they're healthy.
Yeah.
And then if something needs to be taken care of, like cataracts, or if somebody has glaucoma, those issues can be dealt with before we do the more cosmetic procedures. And I will say that when patients have their cataracts fixed, they obviously are going to see better, and that's when they start noticing the wrinkles.
Exactly.
So it benefits me to be involved at Harvard Eye Associates.
Yeah, it's a real, as you said, we've had the doctors on for years now, and it is a very team approach over there.
Right.
And it's a great place. They all do such great work. It's got to be a good, satisfying place to work, right?
It is. It really feels like a family. People know each other, care about our patients. We take care of a large number of patients, and we've been in this area for decades. And I think patients really appreciate that.
Yeah, definitely they do. They have a great reputation. And I know just from the doctors over there that this area, really of the country, when it comes to eye care, is unsurpassed. This is where a lot of the technology comes out of Orange County.
That's right. Orange County really is one of the more advanced areas in the country as far as eye care, and the kind of work that I do as well, which is the cosmetic and reconstructive care that focuses around the eyes and in the face.
Well, it's great to have you on board.
Thank you
over
very
there.
much.
It's wonderful. And as you said, that there are some procedures that may be covered by insurance if it's obviously something that's impairing your sight, right?
That's right. So again,
Okay.
if your sight is being effective, surgery either on the brow area or on the upper eyelids can be covered by insurance, and consultations are available for us to assess that.
All right, Doctor, nice to meet you. I hope to see you back here again.
Thank you very much.
I'm sure we will.
Thanks for your
and
time.
We certainly appreciate you coming by. Harvard Eye Associates is located very close by here. And, I've been talking to them for many, many years. Great folks over there. And now they have another one as well. So
Thank you.
welcome. We'll be right back.